On this episode of the Dr. Tyna Show, I'm going to be disputing the age-old argument that I constantly hear from folks, which is, Dr. Tyna, I can't strength train. I have bad knees. And my counter argument to you is that you have bad knees because you're not strength training. So let's get into it. First off, why should you listen to me? Well, I'm a chiropractor and a naturopathic physician, and I spent well over a decade in clinical care taking care of people's, predominantly their knees. People came to me for regenerative injection therapies. That's what I specialized in. So I was doing prolotherapy, PRP, stem cells long before it was cool. And prior to that, I was working with my mentor who had been doing it for decades. So I've seen a lot of knees in my time. I've seen a lot of bad knees. There are definitely some patterns that we're going to go over. The large majority of people with bad knees had bad knees for one of a few reasons. Number one, it's dietary. If you haven't listened to my podcast episode yet, I have a whole series called Orthopedic Medicine is a Scam. And in one of them, I talk about osteoarthritis and why osteoarthritis really is, at the end of the day, metabolic dysfunction and diabetes of the joint. So go back and listen to that one. I see a lot of metabolic dysfunction leading to bad knees. So, number one, first and foremost, I see a lot of sugar addicts with bad knees, first and foremost. That doesn't mean that traumatic injuries or long-standing biomechanical insults can't lead to wear and tear on the joints. But the way that I was taught in my training was that it was all wear and tear. And I'm here to tell you that I think it's more often than not what you're putting in your mouth. That's a long conversation. Go back and listen to that podcast episode. But bottom line is, if your insulin's high, it's high in your joints. And insulin being high in the joints is a disaster. And if your insulin's high, your leptin's high, and you've got insulin and leptin resistance, and most Americans do. And high leptin is also a disaster in the joint. And we have specific medical data connecting the two. So high leptin, high insulin, bad joint degeneration. All right. So there's that argument. The second pattern I would see is glute atrophy. Most Americans are not actively strength training. As we age, as we go through life, as we sit on our asses all day, we tend to get a lot of glute atrophy. And so our gluteal muscles, which is our buttocks, starts to shrink away. And we will lose it in the face of extreme stress. We will lose them after any kind of wasting issue. So the virus that was going around the past few years is a good example. A lot of folks, including myself, came out of that on the other side with like, hey, where's my butt? It's gone. So there's a lot of reasons why your glutes will turn off, disappear, atrophy. Most of it's, glute amnesia from just sitting on our asses all day, like I said. So that's a big one. And by nature of how your gluteal muscles move your hip joints and control your gait and your hip joints, that is going to trickle down to how our knees perform. And the most common insult I saw to knees, aside from traumatic injury, of course, was medial knee degeneration. So the medial part of the knee, the inside of the knee, starts to collapse. So it's medial knee collapse, basically. This is worsened if you're female because you have a Q angle, meaning from your hips to your knees is a more significant angle than in a man that's more straight up and down. So women will have this more pronounced Q angle, which will also mechanically lead to more pressure on that medial knee. Now, why am I talking about this? I recently woke up with some knee pain, and I'll be damned. I don't have knee issues. I have a whole lot of other orthopedic issues, but I do not have knee issues. And I was like, oh no, this is not happening. This one is not happening. And you know what I traced it back to? I'd been significantly inactive the several weeks prior leading up to waking up with a knee pain. I had been really inactive. I had been under a lot of stress. I was putting together and launching a big course. Some of you saw that, or maybe you enrolled in it, the Ozempic Done Right University. And it was a ton of work. And I was sitting on my butt a lot, staring at my computer, trying to get work done. So what happened? My glutes sort of shut down. My butt was flat. True enough, I remember going out of town and complaining to my podcast producer. He met me in LA for an event that I was speaking at, and I was like, my butt's gone. Now that was transient. It was stress induced and it's coming back. So it's amazing how your glutes will respond when you actually give them some input. But yeah, my knee was hurting. So your glutes being missing from the equation in most people's cases because they're sitting on their derrieres all day. Think about it. You get up from bed, you go sit on the couch. You go from the couch to your car. You go from your car to your desk. You go from your desk back to your car, back to the couch, back to bed, right? That's most Americans. And add to that, most Americans have metabolic dysfunction. 94% of US adults, as of 2018 data, you've heard me say this before, have metabolic dysfunction. And couple that with the obesity crisis that we are facing, and we're looking at a whole lot of knee and hip replacements in the near future. So most of the boomers are predicted to have, they're right in the throes of it right now. Lots of knee and hip replacements. And my generation, Gen X, I think probably is going to fare worse. And I saw that clinically in my practice all the time. The reasons being is we were raised up on really the first generation to get hit the hardest with not only all of the, baby pokey pokes, but a garbage diet. I mean, we were raised on Crisco and Belvita, and NutraSweet was introduced in the early 80s, and fake fats, and everybody moved from lard into just garbage trans fats and canola oil and seed oils and all that jazz. So that transition happened predominantly during my youth and my generation. So we as adults have really terrible cartilage. And I could see this under ultrasound. I looked at people's joints all day under ultrasound for a long time. And prior to that, I was working with my mentor who was doing the same thing. So I have seen thousands and thousands of joints and who they are connected to. And then I get to ask those people, how do you eat? How do you sleep? What's your stress level like? How are your hormones? So all of these play a factor. But the original argument is I can't strength train because I have bad knees. And that is bullshit. It's bogus. And I'm just disrupting that lie right here. There's actually data that's come out showing that that is indeed bogus. And I'm going to share that with you in a minute. But let me give you a little bit of a physiology lesson. The cartilage in your knees is a polyglycan layer, and it is meant to have bounce and be slick. Now, without proper hydration, the bounciness and the slickness it's disastrous. Dehydration is disastrous to your joints. Now add in there inflammation due to metabolic dysfunction and maybe an aggravation to it. Maybe you twisted your knee, or you stepped off a curb, or something happened, or God forbid you've had some kind of knee surgery or ACL repair. So once that chemical inflammatory cytokine nightmare starts up in there, it doesn't really turn off very well. So I've said this before in other podcasts, the mechanical insult will tip off the brewing storm that was sitting there brewing because of metabolic dysfunction. A perfect example is frozen shoulder in middle-aged women, right? In your peri to menopausal woman. That's just classic example of somebody who's just sitting on the edge of a shoulder disaster waiting to happen because they're not training their shoulders. They're metabolically awry, their hormones are off, and then they, reach up for a laundry basket and boom, the shoulder starts freezing up. Similar thing happens, I believe, with our hips. We get frozen hips. Nobody talks about it. I can't find anything in the literature. I have experienced it personally, and I've seen it myself. Frozen hip is a thing, very much like the shoulders. And then with knees, you end up with a lot of knee problems. And if it's one-sided, often that knee had been aggravated by something or hurt or injured at some point in the past. And either it's rearing its ugly head again later on in your life, or you re-injured it later in life, or basically you tipped it off as it was sitting there brewing because of metabolic dysfunction. If you have both knees on fire, I'm going to go out on a limb and say you have something systemic wrong with you. That is a systemic inflammatory problem. And I've talked about that in past episodes. All of those orthopedic medicine is a scam episodes you can check out. So we need the cartilage healthy and happy and not basically being bathed in a pro-inflammatory cytokine, insulin, leptin mess, right? We don't want it bathing. We don't want to be bathing it in that soup. We want it happy and healthy with good, healthy synovial fluid. We want a healthy joint capsule, and that joint capsule will become inflamed for a myriad of reasons: metabolic dysfunction, immune system dysfunction, all kinds of things. Hormonal shifts are a big one. That's why we're seeing a lot of this stuff in middle-aged folks, is because it's not just they wore and tore their joints out and now middle-aged it's showing up. It's because we're having a lot of shifts in our hormones, men included. All right, so we need the cartilage happy, bouncy, and slick. You can do a lot by keeping your metabolic health in check, by making sure you're properly hydrated, getting some bioidentical hormone replacement on board if need be. I've done podcasts on all of this. I've done a podcast about men and testosterone, women and testosterone, women's hormones. There's a whole ton of them. Go back into my podcast and have at it. So those are some of the things we can do there. Now you can take anti-inflammatories and you can take all that jazz. Those actually just destroy your joints more completely. If you're doing some kind of non-steroidal anti-inflammatory drug like ibuprofen or Motrin or any of the NSAIDs are ultimately going to cause further damage to your joints. It's a bad, bad place to start. So not a fan of those. You can mask the problem with more of a Band-Aid natural approach. So that would be like taking tons of fish oil, taking curcumin, taking anti-inflammatory herbs. Those are nice and wonderful, but really you're still not addressing the root cause, which is why is the inflammation brewing in there in the first place. But let's look at it mechanistically. Cartilage and the cells inside your cartilage are called chondrocytes. They thrive off of just the right amount of pressure. So they need pressure on them to actually respond, and they don't want to be crushed. So if you are not moving at all and you are very, packing around a lot of extra weight, every time you stand up, you're just crushing these poor little chondrocytes that aren't really getting a lot of action otherwise. And then definitely there's some insulin resistance there, and there's some metabolic dysfunction brewing and inflammation brewing and all of that. So that's really a disaster. So mechanistically, getting the weight off is really, really helpful. And I've done a whole series around Ozempic done right. I'm not telling you that is the solution for everyone, but go back and listen to those because you will find them intriguing. I have a different take on the conversation, and I think that these peptides, when used appropriately, can be really helpful. So getting that extra weight off, because for every extra pound of weight you're carrying on your body, you're putting 5 pounds on your knees every time you take a step, and you're putting 7+ pounds on your knees every time you actually accelerate even faster. So if you're going for a jog or a run, you're just crushing your chondrocytes. So they're not getting any play because they're not getting any pressure, but when they do get pressure, they're getting crushed. That's most Americans, unfortunately. And that's a mess, right? So we wonder why they sort of peter out. They're not getting what they need. Also, we need movement in our joints. Just mechanically, we need our joints moving because that's how you get nutrients in. It's diffusion, it's movement, and that's how you get byproducts out. So once there's some cellular byproduct happening, they're doing their thing, and metabolically, they've got to get rid of the garbage. That happens through joint movement. So we need those joints moving, and we need them moving through full range of motion. As we get older, our tissues get more and more fibrotic and more locked down. And so things move less and less and less. And then people don't want to move because things hurt. So they sit around, and then they get worse metabolic dysfunction because they're packing on weight. And then it gets more inflamed in there, and it hurts worse, and it gets more fibrotic. And you see the problem here. It's a disaster, and it's what's happening to most people. And people would walk into my office and say, well, I'm bone on bone. And I'm like, join the club. You're just like everyone else who comes in here with knee issues. That's really not the problem. And we have so much data showing that imaging does not always correlate to pain, whether it's your back, your spine, your knees, you name it. Imaging does not always correlate to pain. But what we do know is that proprioceptors and pain receptors that live in your joints, specifically the knees, have a lot of proprioceptors. And what proprioceptors are is they are little nerve endings that tell you where you are in space. And pain receptors also live in there, and they tell you when things hurt. And so you got the two of them kind of doing a dance, helping keep your knee acclimated in space so you don't twist it, you don't take it too far, you don't move too far one way that you hurt yourself. And then the pain receptors let you know when something's wrong. Well, when we have any kind of internal joint derangement, so say you started an inflammatory process through either injury or just chronic degeneration due to the things I mentioned before, then the proprioceptors and the pain receptors start moving around in there. And now you start getting pain receptors grouping up where proprioceptors should be. And so anytime you have any kind of internal joint derangement, you have this whole orchestra going on that actually just sort of leads you into a further mess. Now it's designed, and it's a smart design, so that you quit putting pressure on that part of the joint because it hurts. But unfortunately, this design was made a long time ago before and by, powerful beings before modern life came into play. And modern life really is throwing a wrench in the whole system. So now you're hobbling around, you're limping, things hurt because your proprioceptors are not firing appropriately anymore because they are moving where the pain receptors are now coming in, and they're not telling your knee where it is in space very well. So it kind of is this like downward spiral, if you will. Let's add to this that most joint degeneration, in my opinion, as a prolotherapist, is due to ligamentous laxity. And so, what is the standard of care in any of these cases? Well, the standard of care, unfortunately, is cortisone injections. And cortisone injections melt your tissues further and they make lax ligaments more lax. So, a knee with a bunch of lax ligaments is going to be warbly. It's not going to have good integrity, and it's not going to tell you where you are in space very well. And now you've got pain receptors screaming, and it's all a hot mess. You see the problem. This is what most people would walk into my office in this situation, and we'd have to undo this. And the first thing I would say is, how's your diet? And they're like, what does my diet have to do with my knee pain? And then I'd have to say, what's your training schedule like? And they're like, well, I can't because it hurts, which I understand. I've had a lot of joint pain. So I want to share the study with you real quick. So it's been my long-standing opinion that those who strength train actually have way better knees. And when our knees hurt, or when my knees hurt, the first thing I do is go do squats. And people say, oh my gosh, even when I would go to orthopedic conferences or even orthopedic conferences that specialized in regenerative medicine, they were always telling me like, oh, squats are so bad for your knees. That is bullshit. They are not bad for your knees because why? What I just explained, that cartilage needs to get played. That cartilage needs to get squashed and released, squashed and released. We're pumping it. We're getting the metabolites in and out, right? Or the nutrients in, metabolites out. We're getting the cartilage to do its thing. We're getting the chondrocytes to wake up. We're getting the fibroblasts to wake up. We're getting the stem cells in the area to congregate and wake up. And we're giving it a little hormetic insult. And that is the beauty of squats. We need to actually use our knees, and we need to use them through range of motion for them to be healthy. Now, sometimes folks who do a lot of tennis or golf, that shearing motion on the knee where that femur is shearing on that planted foot and tibia, that can cause a lot of knee degeneration too, especially if those folks are metabolically unsound. I see a lot of golfers as they age really start packing on the midsection. I see a lot of tennis players actually, mostly in my practice, what I saw was tennis players with really low hormones, like their hormonal profile was sort of in the toilet. But studies have showed that tennis players live a really long time. So tennis is an awesome sport, but there's a lot of planting and shearing. And then if your hormones are low, your cartilage and your tissues are not going to heal well. So anyway, this was a October 2023 article in the Journal of Arthritis and Rheumatology. Strength training is associated with less knee osteoarthritis, data from the Osteoarthritis Initiative, which is a really interesting, this is really interesting for you to read. I'll put the links in the show notes. Basically, strength training at any point in life is associated with a lower risk of knee pain and osteoarthritis, contrary to persistent assumptions of adverse effects. The methodology here was researchers reviewed data on strength training and knee pain from 2,607 adults, all different age ranges. The participants were enrolled in the Osteoarthritis Initiative, which was a multi-center prospective longitudinal study. 44% were male. The average age was 64.3 years, and the mean body mass index was 28.5. Strength training was defined as those exposed and not exposed, as well as divided into low, medium, and high tertiles for the exposed. A total of 818 individuals were exposed to strength training, and about 1,800 were not. Okay, so we've got 800 to 1,800. And the primary outcomes were frequent knee pain, radiographic osteoarthritis that, you could see objectively, and symptomatic radiographic osteoarthritis. Remember, I said those are two different things. The takeaway was the study is the first to examine the effects of strength training on knee health in a community population sample not selected for a history of elite weightlifting. So these were just normal folks. Overall, here's the key. Strength training at any point in life was associated with a lower incidence of frequent knee pain and radiographic OA and symptomatic radiographic OA compared to no strength training. When separated by the tertiles, only the high exposure group had significantly reduced odds of frequent knee pain. These findings were similar for different age ranges, but the association between strength training and less frequent knee pain, less radiographic arthritis, and less symptomatic radiographic arthritis was strongest in the older age groups. In practice, our findings support the idea that the medical community should proactively encourage more people to participate in strength training to help reduce their risk of osteoarthritis and other chronic conditions, the researchers write. So there you have it. And there's other studies to back this up as well. So go out and squat. That is your homework. If your knees hurt, go out and squat. Now, I understand strength training is a skill. Not everybody has access to a trainer. If you do hire a strength and conditioning coach, please have somebody get eyeballs on you, especially if your knees hurt. Find someone who knows how to work with older folks. Even if you're younger, if you have injuries, find someone who knows how to work with injuries. That's a whole different beast than just your regular personal trainer. Find someone who is good, especially if you are in the middle-aged age group like I am, that's good with middle-aged and older folks. They will get you moving in the right direction and make sure you do so safely. If you don't have access to that, be careful what programs you buy online. You know, there's a lot of young folks doing some crazy moves, and anybody can put out a strength training program. And we want to make sure you're not hurting yourself worse, because if you hurt yourself worse, you'll stop strength training and then you're going to get worse and worse and worse, right? Things are worse off. Go back and listen to my podcast episodes about prolotherapy and regenerative injection therapies, because those are some options as well. And then if you don't have access to a strength and conditioning coach, I have an awesome program. It's called Dr. Tyna's Strength Corner. It's really well priced, and there's some great workouts in there to get you started. There's tutorials on how to squat properly, how to deadlift properly. And I'm adding to it as we go. So I want to make sure that this is approachable and applicable to every age group, because I really just want people moving. And I have a lot of older folks who follow me, and I want to make sure that you're all strength training. Strength training is for everyone, and it's for every age, and there are ways to access it. And we just have to figure out how to get you moving so that you feel comfortable. And for a lot of folks, they don't want to go to the gym. They want to do it in their home. And that's why I created this program. So you guys can check that out. I'll put that in the show notes as well. And I'll make sure there's a coupon code there for you so that you can get a discount on it for being a listener of the Dr. Tyna Show. And that's it for this quick and dirty.